While there are over 1,000 types of documented hemoglobinopathies, only a portion of them are known to have clinical significance, although the severity of that clinical impact may differ from patient to patient. Overall, clinical laboratories are essential in the detection, diagnosis, and management of hemoglobin variants in thalassemias. Accurate and precise testing techniques are crucial for providing patients with the necessary information for medical care and genetic counseling. Hemoglobinopathies, as we outlined and defined in the previous videos, can be broadly categorized into quantitative and qualitative disorders. Quantitative globin defects result in thalassemias, reduced hemoglobin levels due to reduced globin chain production. Qualitative defects are associated with variants, the production of abnormal globin chains, which are then constructed into abnormal hemoglobins, including the most common hemoglobin S and the sickle cell disease that arises from it. Identification of the underlying pathogenic hemoglobin variant or variants is important for treatment and genetic counseling. When a patient sample is sent to the laboratory for hemoglobin variant screening, several methods may be employed to determine which hemoglobin variant is present. Most commonly, the hemoglobin proteins within a blood sample themselves are analyzed by electrophoretic techniques such as capillary or gel electrophoresis, or by affinity to a column in the case of high-performance liquid chromatography, also known as HPLC. These techniques all separate the various hemoglobins into individual fractions based on differences in charge, shape, structure, or hydrophobicity in order to detect the presence or absence of normal and abnormal hemoglobins. These techniques are fast and relatively inexpensive, as opposed to genetic analysis, which looks instead at the patient's DNA, attempting to isolate the exact mutation within their globin genes. As there are so many documented hemoglobin variants and the diversity of modern populations means that we can no longer assume where the common variants are typically encountered, a hemoglobin screen must be ready to detect and identify any of a large number of variants. As a result, multiple techniques will typically be used in combination to determine a patient's abnormal hemoglobin type. Each hemoglobin variant has a characteristic size and charge dictating a specific migration position on an alkaline or acid gel, or position on an electropherogram on a capillary electrophoresis instrument. Each hemoglobin also has a characteristic retention time on HPLC based on their affinity for a cation exchange column. The difficulty is that while these positions or retention times are characteristic, they are not unique. Many variants may have similar or identical electrophoretic positions or retention times. However, very few variants have both in common, so the use of multiple techniques will typically isolate a single variant suspect. One technique is typically used as a screen to first detect the abnormal hemoglobin and narrow down the list to a bare handful for a presumptive identification. The secondary technique is then used for the final confirmation of the variant present. This is all sufficient to identify common variants and most rare ones as well. In a few cases, it may be necessary to conduct further genetic tests to confirm rare, clinically significant hemoglobin variants. Several important characteristics are desired in an effective screening technique. To maximize efficiency on the frontline test, a rapid throughput technique can keep up with the higher volume of the screening test, while a high-resolution technique is desired to narrow down the list of possible variants most efficiently before reflexing to the confirmation method. In the next video, we'll look at capillary electrophoresis as a frontline screening option for hemoglobin variant detection.